What if you could lower your blood pressure in the time it takes to brush your teeth with no pills and no fancy equipment needed? Well, the answer is yes, and that's what we're gonna talk about in today's video. By the way, I'm Dr. Mitch Rice, board certified family medicine physician, and today I'm gonna give you 3 proven techniques to instantly lower your blood pressure. These are the exact strategies that I give my patients every day, and the thing is, they actually work. But first, let's get on the same page. Blood pressure is the force of blood pushing on the inside walls of arteries. It's measured using 2 numbers. The top number, called the systolic blood pressure, is the blood pressure when the heart is beating. And the bottom number, called the diastolic blood pressure, is the blood pressure while the heart is at rest or in between heartbeats. Most commonly, when we're looking at blood pressure, we tend to be a little bit more concerned about the top number, or that systolic blood pressure, rather than the diastolic blood pressure. And these 3 techniques we're gonna talk about today are most impactful at lowering the systolic blood pressure. So now that we know a little bit about blood pressure, the first thing that you can do to instantly lower blood pressure is to massage your ears. Yes, you heard that right. Massaging your ear can lower your blood pressure by quite a bit. Specifically, this is known as auricular acupressure. So what you want to do is you want to take 2 fingers and gently rub the inside part of your ears. You want to focus on the area where the ear canal starts to form, and you want to apply light, continual circular pressure for about 90 seconds. So you may be asking yourself, how does an ear rub actually lower my blood pressure? Well, if you've seen my previous video, you may know that there are certain mechanisms that trigger the release of tiny little unicorns that help innately lower blood pressure. And this just happens to be one of those times. Okay, I'm joking. Sort of. When you massage your ear, you're actually stimulating the auricular branch of the vagus nerve. This activates a direct parasympathetic stimulation, which acts as the brakes of your nervous system. If you've ever heard the difference between fight or flight or rest and digest within the human body, well, that's actually describing the differences between the sympathetic and the parasympathetic nervous systems. These are effectively the gas pedal and the brakes of the nervous system. So what's happening when you're stimulating that vagus nerve from the ear massage, your body's saying, it's okay, it's time to relax now. The result is a shift from that fight or flight or sympathetic response to the rest and digest or parasympathetic response. And this leads to a lower heart rate, dilating those blood vessels, and ultimately lowering your blood pressure. Some researchers even call this the neuroanatomical shortcut to calming the body. This is because you're accessing the vagus nerve externally without the use of pills, meditation, or lying down. This provides a small but meaningful drop in systolic blood pressure, anywhere from about 5 to 8 millimeters of mercury, in about 90 seconds. Now, the first technique was good, but I actually find that the second technique is even better, because you can do this technique in under 60 seconds if you practice it consistently. The second technique is a guided body scan. You may be thinking, if my blood pressure is a physical thing, how can a guided body scan actually change my numbers? Well, the truth is that your thoughts can control your physiology. And that's especially true when stress is the culprit to raising your blood pressure. A simple 60-second body scan can shift you into that rest and digest state, which signals your blood vessels to relax and slightly dilate in a similar mechanism that we talked about with the ear massage. So what you want to do is you want to sit down in a chair comfortably in a somewhat upright posture with your feet planted on the floor. You want to close your eyes and then bring your awareness to your feet, and then slowly scan your attention upward, going from your legs to your midsection to your chest, jaw, and all the way to the top of your head. The best way I've ever heard this described is essentially you want to feel like there's a warm mist at each little cross section of your body that you're focusing your awareness on. If you're sitting resting comfortably in a chair, you want to feel on your feet exactly which parts of your feet are touching the ground. Is it your heels or the balls of your feet or the outsides of your feet? And then you want to feel a little bit of warmth at your feet and slowly move up to your ankles, legs, etc. Even short sessions like 60 seconds can really make a big difference and can significantly drop your blood pressure. And the thing is, the more you practice this, the better you can get at it to where you can do body scans in about 60 seconds and really lower that blood pressure significantly. Now, the third one on this list is my personal favorite because it seems so counterintuitive. It's also been proven to lower blood pressure permanently if used consistently. And that third technique is a warm water foot soak. Again, you may be thinking to yourself, I thought hot water actually raised blood pressure, right? Well, honestly, localized warmth to certain areas of the body can actually do the opposite. So here's what you want to do. You want to fill a bucket or a bathtub with warm water, not scalding hot water that you're going to burn yourself, but pretty warm water. You want to soak your feet in this tub of warm water for about 10 to 15 minutes in the evening. Now you'll notice that your blood pressure starts to drop even after only soaking your feet for about 2 to 3 minutes, but to get that full effect, you want to do it for about 10 to 15. A bonus thing that you can do is add some Epsom salts to the water, also known as magnesium sulfate, for maximum relaxation. Now, heat will dilate your peripheral arteries, specifically in the legs and in the feet, which helps draw blood away from your core and helps to decrease total vascular resistance. What that means is the warm water can redirect blood flow towards your feet and ultimately helps stimulate a little bit of an increased parasympathetic response. Doing this for just 10 to 15 minutes can reduce that systolic blood pressure by up to 10 millimeters of mercury. And again, if you do this consistently about 4 to 5 times per week, it has been shown to permanently lower blood pressure. Now, if you can't remember everything that we've talked about in this video, that's totally fine. I put together a free PDF that has all the information from this video as well as part 1 in my 3-minute blood pressure reset guide. It's completely for free and I have it linked in the description below. Also, if you haven't seen part 1, I give you 3 more tricks to instantly lower your blood pressure. So I highly recommend checking out this video and you can do so right here.